Hi, it's Congresswoman Jan Schakowsky back with my plans and pans. I'm here in Washington, D.C. right now, about to go home for the weekend and for the celebration of the Jewish New Year that I will be going to my synagogue in Evanston, Beth Emet. But it was a busy week, and we'll be back next week to try and conclude before the election many of the work that still needs to be done. I wanted to tell you something very dear to my heart. This week I introduced a resolution called the Dr. Paul Farmer Memorial Resolution. I think I told you some time ago that this cherished friend of mine, Paul Farmer, really the leader in the country and around the world on global health, committed to making sure that even in poor countries where some critics would say, well, there's not good transportation, the people don't have the education, Paul believed that every single person had the right to health care and could get the health care they need. And so he developed something called DOTS therapy, which means direct observation therapy. That is, he developed a method that said, yes, we will send people, community health workers, wherever it is, up the mountain, down the hills, and with them will come the medication. And we'll have people observe people in poor communities take their pills twice a day. They will go back and plus pay the people, the community health workers. Now we've seen even places in the city of Chicago like Mount Sinai Hospital that is doing these kind of community health workers. Is becoming more and more popular. Paul died too soon, but his belief in making sure that universal health care was for everyone is something that we have embodied in this resolution. For example, we say that for $125 billion a year every year, we could actually save millions of lives around the world. Right now, we know that about 10 million people die unnecessarily every 10 years. But if we had, in the United States of America, a regular allocation of funding. Now, remember, you say, oh, well, that's a hell of a lot of money. But you know, just this year alone, we have spent over $600 billion just on the defense budget. So we're talking something far less than that. So clearly we could do more, and we learned from the pandemic it is worth doing that because when you have a pandemic that is around the world, all of us are in danger if we don't help people around the world get the health care that they need. So I'm very proud, along with Barbara Lee and Dr. Ruiz, who is also a member of Congress, to introduce this resolution and to continue to push the vision of Paul Farmer that everyone deserves health care and the United States can do a bigger part in making that happen. Also this week, I was invited by The Hill, that's one of the newspapers on the Hill, to a forum on dental health. So, you know, I began in this room full of advocates, people, some dentists I'm sure were there as well, people interested in healthcare, especially for low-income people. But I said to them, raise your hand if you have terrific health insurance. You know, in a pretty full room of people, there were 3 people who raised their hands. And if I asked you that, I wonder if you've got really good health insurance. It's very rare. And oral health is very, very important. There are about 70 million people in our country who have no health insurance at all, and many more that have pretty inadequate insurance. And the consequences are really grave. Did you know that the chances of getting diabetes, if you don't take care of your teeth, is a real possibility? Those numbers go up. And also there are several kinds of cancers that can actually be exacerbated without the oral health that we need. When it comes to low-income people, we know that about 25% of low-income people have said they're having trouble getting a job. Because think about it, if you don't have good teeth, or maybe you have no teeth, it's very hard to go on an interview to get the kind of job that they need. So there are all kinds of consequences. During the pandemic, I know my dentist shut down, and many of yours, and there's been a real drop in the people who have gone back to see their dentist. I admitted at that meeting, I am one of those people. I need to go back and get it. I wanted to also just mention the cost of dental care is absolutely exorbitant. You know, even a screening cleaning can cost hundreds of dollars to get. And then if you have a root canal or a crown, you know, we're well into the thousands. And so dental health is not covered under Medicare, unfortunately. We want it to be. I have supported legislation that would actually make that happen. Some Medicare Advantage programs do limited dental care, but in Chicago, because you have to be in network to get that, even then, it's not easily accessible to get the dental care that you need. So, you know, that was the subject of this workshop, really, that I was part of. We have also passed important legislation, I would say, since the attack of January 6th, it's become more and more important. And that is the Election Reform Act. And, you know, one of the things that we were concerned about, you know, some states had these fake electors that they wanted to replace, use to replace the actual electors in a state that got to vote on whether or not we would certify the election of the duly elected Joe Biden as the President of the United States. This legislation states that states will not have the option of deciding a different set of electors. It also said that the Vice President of the United States would not have discretion about when we would certify an election, and it would have no authority, him or herself, also to change who the electors are. So we are trying to close any loopholes that we experienced in that horrible day on January 6th. And let's remember that we actually had most of the Republicans vote against the certification of Joe Biden as President of the United States. But at least there will be no legal ability to change who the electors are. Very important reform that we now passed. I was very happy that in an Energy and Commerce Committee, where I have served for many years, a very important bill that came out of my Consumer Protection and Commerce Subcommittee passed. I am a horse lover and enthusiast. Used to own my own horse. Even one time got a ribbon in a contest jumping over fences with my horse. We weren't particularly good at it, I have to say. But there is a practice called horse soaring that is so inhumane, it may be hard for you to believe, that in order to prepare for horse shows where the lift that the horse gives of their hoof can determine how beautiful they look and make them more likely to win a prize in these horse shows. And the way that is achieved in some places is by hurting the horse's foot to the point that there is enough pain that would require them to raise their hoof. They can put, sometimes in horse soaring, caustic chemicals are put around their hooves. In other cases, sharp objects are put there. And so we were able to pass this legislation, the PAST, P-A-S-T Act, which would prohibit horse soaring. I was very, very proud of that. Finally, ending with COVID, I did get my booster shot, and I've been feeling absolutely fine. I haven't had any pain in my left arm. I did feel kind of tired yesterday, but nothing much. You know, I could have felt tired because I often don't get enough sleep. So I just want to encourage people 12 and older can go get this this booster, and it mostly addresses the Omicron, which is the most common kind of problem that we have right now in our country, that variant. So, you know, take advantage of it. It's free. Go make your appointment and go get it. We also reported still in Illinois last Wednesday, 3,438 new cases of COVID and 16 new deaths. So it's still with us, and you know, do what you can to continue to protect yourself. So for those for whom it's appropriate, Happy New Year to you on in the Jewish community, and for all of you, I hope you have a wonderful weekend. I'll see you next week. Thank you for watching my video. Make sure you subscribe to my YouTube channel and follow me on Instagram, Twitter, and Facebook, where my handle is @Jan Schakowsky.